since the Marburg virus outbreak was declared on September 27th, the country has implemented several measures to contain the spread and protect the population in light of the rising concerns. Today, we are honored to be joined by the Honorable Minister of Health, Dr. Sabin. Welcome to the studio to clear more on the concerns that people have. As we said, it's been almost a week since the Marburg virus was detected in Rwanda, and there are effective measures that has been put in place to ensure that people stay safe. How effective are these measures being giving results, or is it so soon to say that it is giving results?
Great. Thank you very much. As you actually said, it's almost a week since we first detected this virus, Marburg, in Rwanda, which triggered a response system to detect more cases which were found. As of today, we've confirmed about 29 positive cases. We expect this to increase as we actively find more, and it's very normal with the evolution of the disease. The very first days you may detect more until we reach a plateau, and then you start to bring it down. Unfortunately, this is a disease associated with a high mortality rate. We've lost 10 lives, and probably even we're trying to minimize and getting to save all lives that we can save. So today, to say that where are we heading, how are we going to end this, probably too early, but we have hope that with the means and mechanism put in place, with the government and partners and community also contributing to making sure we don't have more contacts, wash hands, we detect these symptoms, high fever, severe headache, and muscle pain. These are typical symptoms. We may reach very soon a level where we say Marburg is going to an end, but these are results that we have to invest in right now, working together. But it's possible, and we're going to achieve that, but we must really be together this critical phase to make sure we detect every single suspect or case that might be somewhere. So I would say that we've made progress, and at least we've reached out to all contacts, and those who are seeing positive these days are those who were exposed by the time we detect it, and we're trying to run faster ahead of the virus, and soon we may reach that time you're asking.
Yes. Moving ahead, we've noticed institutions taking other preventive measures. There are preventive measures put in place by the Ministry of Health, but other institutions are also putting preventive measures to curb the spread of this virus. How do we balance these strict measures that are being put in place with the message that you recently gave, telling people, urging people not to panic in moments such as this?
So the containing this virus is all about avoiding close contacts. And avoiding close contacts are necessary at this particular time, but we don't want to also create panic, which means schools are not closed, movements are not actually prohibited. We keep doing business as usual, but with caution. In schools, in places where people gather in big numbers, we need to have that extra caution, but without disturbing the process. And this is a limited period of time as we try to maximize our detection of any suspect case or any indicative based on symptoms. So the guidelines on schools, guidelines on other mass gathering, people being together, it's all about trying to minimize these close contacts. But we are not at the level to say don't go to the market or don't go to school, because we can use the means we have and the progress we've made to contain this outbreak very soon. But it will depend on everyone's contribution. As I said before, we've done it with other outbreaks, community, contribution, scientific contribution, but also leadership and communication. Are the three pillars that we have to put together to reach to a place where Marburg has been contained fully.
Yes, there are so many information about this virus, but we would like to know who is more at risk of being infected with the Marburg virus. Is it adults, is it children, or everyone is at risk? And additionally, how is the ministry positioned to curb the spread of the virus?
So thank you. Those are very important questions. Of course, everyone is at risk if you get to the contact with the virus. But people have to understand that the virus is not airborne. It's not a virus that will come to you from someone who doesn't show symptoms. And the virus will not come to you if you touch surfaces or you close contact with someone and wash hands and use sanitizer. This are proven to work and to kill the virus in case you've been in contact with it. But it's very important to mention that it's a virus of close contact, and that's why healthcare providers have been affected, because they are in some procedures they sometimes find themselves in contact with patients who are actually having all these symptoms, these body fluids, blood, and that is the most at-risk group. Even in other countries, in other outbreaks, healthcare providers were the most affected. Unfortunately, is the case also for us, and that is what we're doing to make sure we protect them, but also we protect the community, because the virus can also come from those who are infected and spread. And we don't want to go at that level. That's why we're trying to implement different types of measures in this particular first week of detection.
Yeah, emphasizing on what you just said about healthcare providers being more at risk because they attend to these patients. You said it that most of the people that died from this virus are healthcare professionals. What is being done to protect them? Still, they're at the forefront. They are taking care of these patients and they are receiving patients on a daily basis. But what is the ministry or the country doing to make sure that they are protected, but also they can still give the services that they give on a daily basis?
Absolutely, that's very important. Infection prevention control have been taken to another level. I mean, it's a virus that can easily evade some level of protection. But once you practice the hand washing and sanitizing and protection that are available in facilities. So the government have been providing these protective equipments. With this situation, we even have more, another layer of protection. But the most important protection comes from also personal compliance and decisions, not only for healthcare providers, but also for any other person. We have to go back to our practice of hygiene, hand washing, avoiding unnecessary contacts that may lead to picking a virus without even knowing. For them, it's hard to not face people with symptoms because that is the risk of their job. But also there is another layer of protection and understanding that it's not like other exposure. There is a very severe virus that they are facing, but it's not out of control. Unfortunately, it has taken lives, and we regret that happened, but we have to make sure that doesn't go and take more lives if we can stop it right now.
Honorable Minister, before we end our insightful discussion, what message would you provide to Rwandans in this fight against this Marburg virus?
Thank you. I have two things to say. One, if you see or you have high fever, severe headache and muscle pain and high fatigue, please don't take it simple. It might not be fatigue, might not be malaria. It could be something like Marburg. Give us that opportunity to pick the virus early and to follow up, treat you, and also prevent the spread. Second, hand washing sanitizing, avoiding contacts is very important at this critical time. And very soon we will win, but we need your contribution to this battle.
Thank you, Honorable Minister, for sharing these important updates. And as the situation continues to develop, we encourage everyone to remain vigilant and informed about the preventive measures put in place. Thank you.
Thank you very much.